Still watching Village Square Africa, and we are still talking about the statistics of malaria in Nigeria and the death toll as well that has drastically reduced to about 55%, which of course is good news for the country. But we're trying to establish that even though that is good news, we still have a disturbing number of malaria cases that need to be fought and eradicated. With me, I still have Dr. Philip Njamanze, a medical doctor, Chidikon Medical and Diagnostic Center Limited. Dr. Philip, thank you for still being here with us on the program. Dr. Philip, are you there?
Yes.
All right. Dr. Philip, now you did mention that even though the 55% reduction rate is a good thing, we still have a large number of people suffering from malaria. Why is it that we have that much number?
Yes. The number is unacceptably high. If you have 68 million people and 194,000 dying, and 68 million people having the disease, even if it has dropped by 55%, it really does not give you any comfort. But because the number is unacceptably very high. And it reflects that the system is deficient. The Nigerian health system is very deficient to address the malaria problem and other vector-borne diseases. And as we have said before, there needs to be a structural adjustment of the health system. The health system everywhere must be on a tripod on research, treatment, and prevention. This tripod must be in any health system for that system to be resilient and be able to respond to the challenges of disease control. What you have in Nigeria operational in the real sense of it is just the treatment arm. The prevention arm, which just started with NCDC, is mainly a data collection center with basically very, very little infrastructure. Then, of course, there is complete absence of the research arm, which should have been the National Institutes of Health. The National Institutes of Health is a granting agency which should have billions of naira to offer grants to investigators both in the public health sector and in the private health sector to address the problems of health. This is how it is done in every country that has a real health system. So we can't even call the Nigerian system a health system, because system means that it has several parts which synergistically work together to achieve a given goal. This is not the case in Nigeria. What you have is just a disjointed system that is not really designed to address disease control. So what we need to do urgently, and is something that the present government and subsequent ones should address, is to have a properly designed system in place. And there is no system of any serious country which contracts disease control to international organizations or foundations. That's not how it is done. The proper thing to do is that all donor agencies, both international foundations, they contribute to a common pot, what we call common basket. So when they come to, if they are interested in helping with malaria or tuberculosis or COVID, then they contribute to a common basket. And when they contribute that to that common basket, it's put into the national health budget. And that budget now is streamlined to the priority problems we have. So, there is no room for international agencies or foundations to be pinpointing one particular problem and then budgeting huge amounts of money to that problem and that actually destroys the health system, because what it does is kills that health system, take all the important personnel and all the important resources to that problem, even though it's not a priority problem. It now takes away from all other areas of which are actually otherwise priority in the healthcare system. So that Nigeria should not be allowing that to happen, whereby people can come in and say, "Oh, we are interested in HIV/AIDS," and then the budget for HIV/AIDS will be 10 times that for malaria. And of course, with that type of system, what you will have is exaggerated death and cases in malaria, and it will not really reflect the health priorities of the country. So there is a need for a wholesome redesign of the health system, because what we have now is nothing to call a health system. And what the international organizations and donor agencies are doing is actually not helpful, because they skew the health system and get it not to address the priority areas we actually need through the budget system.
I'm glad you did mention some other health challenges that we're having in the country, because I was going to go to that. Now, we're saying that we still have a huge number of people suffering from malaria in Nigeria, but that's not to say that this growth is not a good one. So the question remains, how do we replicate this maybe progressive growth, no matter how slow or how little it is, in other health related issues that we have in Nigeria?
Malaria is a vector-borne disease. And one thing good about addressing vector-borne diseases is that you can actually pinpoint how to stop the disease process. And with other diseases, most of the diseases we face are vector-borne. That means there is an intermediary host, which, just like the mosquito will bite the person who has malaria and then passes it on to somebody who is malaria-free. So that is what we call the vector. And that vector, we must do vector control. That means we really find out where these vectors are going, and we go there and actually eliminate them with insecticide. That was what Europe did. That was what the United States, Russia, and all these countries who have gotten rid of malaria. So they get rid of the vector. And the vector control processes now are actually virtually absent in Nigeria. You see the gutters are littered with wastewater, and nobody is cleaning them. Nobody is introducing any form of insecticides and all that. Just across the state. So we are not even doing the needful that can be done with controlling the ecosystem of the vector. Now, when it comes to to Nigerians themselves, yes, it was a good thing to introduce mosquito nets, bed nets. Then it was also a good thing to introduce the drugs, the very highly active artemisinin combination-based therapy for malaria, and that actually is what has brought down the incidence and, of course, the mortality from malaria. However, we could actually do this a lot better. And how do we do this? And we have gone, and the research here in my institute has shown that if we were to let everybody across Africa or even across Nigeria to take the same anti-malarial drugs to take and feel good about it, if they were to take that 4 times a year at intervals of every 3 months, and we have 4 malarial days throughout the year, and they take it at the same time, whether they have the syndrome or not. So what we will result in doing is that we will wipe away the parasites in blood. So when we wipe away the parasites in blood, when the mosquito bites you and then wants to transmit it to another person, there is no parasite in that blood, which the mosquito has sucked from the host to transmit to the next person. By doing this, 4 times a year for just about 2 years, we can get rid of the high incidence of cases of malaria, and that will bring down mortality. And we might even get to the point we can eradicate the disease, because once we eradicate those vectors that still have the parasite in blood, and we will actually result in eradicating the disease, even when there is mosquito, but when it bites, it cannot transmit the parasite. And this is possible to do. Unfortunately, there has been this rush into vaccines. Vaccines are useful, but they are useful for doing focal control in a very specific group, in a very specific location. Let's say they want to target underbites in a particular place.
Okay. So, thank you, Dr. Philip. Very quickly, we want to see if we can just get opinion from Dr. Noble, ART clinician. Dr. Noble, thank you so much for joining us.
Thank you, Blessing. Thanks for having me.
All right, very quickly, what do you think of the statistics of malaria, the declining rate, the declining number of malaria, and what can be done to replicate it in other, health-related issues?
First of all, it's a welcome development, because Nigeria makes up 27% of the global burden, which puts us as over 68 million people living with malaria. So what we can do now, we have to increase, because Nigeria is a, should we call it a middle or low income country, we have to increase testing services. That's where the malaria rapid diagnostic kits come in. They have been able to be circulated through rural communities and hard to reach communities. We also have to, there is no particular method. It's a complex of activities and initiatives that have to come together. If we have to achieve this goal, we have to equip the healthcare system better. There has to be a proper drug distribution. There are areas that don't have access to artemisinin-based combination therapy. We are having a lot of increased drug resistance due to polypharmacy, health illiteracy. So those gaps have to be bridged. We also have to focus on cross-border malaria cases. So that's where our chemoprophylaxis comes in. These are ways we can replicate this data. We have to increase the number of healthcare practitioners that are trained. We have to see it more as not just a healthcare issue, but a country, a national issue.
All right, thank you so much. Thank you so much, Dr. Noble. Just like you mentioned, this is a welcome development, but that doesn't mean that we need to relent. From what Dr. Phillips said, he mentioned that there is a need for a wholesome redesign to the health system. I really want to appreciate you both, gentlemen, for making this very interesting, interactive, and also informative as well. Thank you so much, Dr. Philip Njemanze, medical doctor, Chidikon Medical and Diagnostic Center Limited, and also a big thank you to Dr. D. Allens Noble, ART clinician and Ibadan Humanitarian of the Year and founder of Saving Women and Children Foundation. We really do appreciate your time with us on the news. Well, this is where we call it a wrap on Village Square Africa today. Do join us again on the program as we bring you more topical issues across the African continent. Stay with us. The news is up next. My name is Blessings Musugu.